In alignment with the requirement of the Texas Education Agency and Dallas County Health and Human Services, Mesquite ISD has developed a plan to promote a safe return of students to the campuses. The purpose of this PowerPoint is to familiarize the Mesquite community with the re-entry plan for welcoming students back to in-person instruction following the declaration of the COVID-19 global pandemic. Part 1 of the plan addresses prevention. What will Mesquite ISD do to prevent COVID-19 from entering the schools? Mesquite ISD requires all staff and students to complete a self-screener each morning. The self-screener involves a daily temperature check. Therefore, the expectation from Mesquite ISD is that this prevention measure be done with fidelity. The reporting of symptoms must be done responsibly by each adult. All persons must exercise personal responsibility and remain home if sick. As required by the Texas Education Agency, the governor's executive order for face coverings must be followed by all students in grades 4 through 12, as well as all staff members and all campus visitors. While not required by the order, Mesquite ISD highly recommends masks for pre-K through 3rd graders. Mesquite ISD also has a daily deep cleaning process. Additional staff, if necessary, was added to clean common areas throughout the day of the campus. Sanitization backpack sprayers have been ordered for each campus. Each campus is sanitized completely each night. Deep cleaning as soon as possible upon notification of a confirmed lab or a suspected COVID-19 case is done. Mesquite ISD has had district and campus collaboration. Administrative Services has assisted campus administrators in reviewing and adjusting the following: campus entry, transition and exit plans, cafeteria procedures, recess and common area evaluation, student movement throughout the building, and management of student supplies. Mesquite ISD has developed safety protocols. The protocol for food and nutrition services involves students washing their hands before entering the cafeteria and again when leaving the cafeteria. The protocol prohibits students from self-service. You'll see more of a Luby style line. The protocol excluded the use of keypads. Students scan an ID badge or a card given to them by Food and Nutrition Services. The Food and Nutrition Services staff follows all Center for Disease Control guidance as well as the Texas Restaurant Association guidance. The protocol for transportation services involves students sanitizing as they get on the bus and again when they get off the bus. Hand sanitizing stations have been installed in each bus. You will see controlled loading and unloading by the bus driver. Masks or face coverings will be worn at all times. The buses will be sanitized after each route. Additional protocols include, but are not limited to, campus mitigation, counseling, enrollment, physical education, visitors to campus, library services, athletics, drill, cheer, clubs, and organizations. With respect to visitors on campus, unlike staff and students, visitors may not have completed a self-screener with the temperature check component. Therefore, all visitors to campus will have a temperature check prior to entering the main building. Mesquite ISD has additional prevention measures that have been provided to the campuses and to students. Printed posters, floor markings, and signage for visual reminders for everyone to exercise healthy practices and to remain a safe distance from others. A video bank of resources that teach safe and healthy practices has been developed and provided to the campuses for use. Water fountains throughout all our campuses have been disconnected. We have purchased sensor water bottle dispensers that have been installed in each cafeteria for use throughout the day. We have purchased an abundance of soap and hand sanitizers, and we have provided one-to-one devices for our students. The next phase of the plan involves response. How will Mesquite ISD respond to lab-confirmed or positive symptoms of COVID-19 in schools? The graph above shows the process and is divided into two parts. The blue box refers to someone who has been lab-confirmed positive for COVID-19. They may return to school when all of the green boxes have been satisfied. The green boxes represent the quarantine period. So in order for a positive lab-confirmed person to return to the environment, they must meet all three: improvement of their symptoms, 24 hours have passed since recovery. In other words, they have no fever without medication to mask the symptoms, and 10 days have passed since symptoms began. The yellow box, or orange colored box, refers to positive COVID-19 symptoms. So if you have symptoms but have not been tested, you can return when, go over to the green boxes again, all three of those under the quarantine period have been met. So that is for someone who has not received a test. They still must meet all three of the boxes that are green under quarantine period. If the positive symptom person wants to return before they have met all three of those green boxes, they must provide a medical professional's note clearing them to return to school or work, or receive an acute infection test at an approved location that is negative for COVID-19. The final phase of the plan is provide notice. What will Mesquite ISD do once a lab-confirmed COVID-19 case has been reported on the campus? And how will Mesquite ISD notify staff, students, and parents? First, in the event of a COVID-19 positive case on campus, the campus will take the following steps. All the areas that are heavily used by the individual with the lab positive case will be closed off until they are able to be disinfected. The lab positive COVID-19 individual will be excluded from the campus until they meet the re-entry criteria to return for in-person learning. Close contact is critically important for all to understand when determining the risk of exposure. The Texas Education Agency and the Center for Disease Control define close contact as: first, being directly exposed to infectious secretions, being coughed on or sneezed on, or being within 6 feet for a cumulative duration of 15 minutes. However, additional factors like case contact masking, in other words, both the infectious individual and the potential close contact have been consistently and properly masked. What is the ventilation? Is there a presence of dividers in case symptomology may affect this determination? So that is significant for all of us to remember when dealing with someone who is positive for COVID-19. We ask ourselves, did we have close contact? And how is close contact defined? All teachers, staff, and families of all students in that school will be notified of the lab positive COVID-19 case through electronic notification. The notification will specify whether the lab confirmed case is a teacher, support staff, or student, and close contacts will be notified by campus personnel. Due to the federal privacy laws, Mesquite ISD will not be able to reveal names of the lab-confirmed individuals. We hope this presentation answers some questions. However, we would appreciate your thoughts. Please participate in the thought exchange activity to follow. Thank you.